So what's going on with the lap band? It seems like the number of patients who are coming to us for placement of an adjustable gastric band is decreasing monthly. And the band has its place in the armamentarium to treat obesity. And the thing about the band is by far it's the safest. The mortality rate for placement of a band really does approach zero or is as low as any operation to treat obesity. And for some patients, they say, I understand the risk of the band, and that's the risk that I'm going to accept, and I won't accept the risk of any other operation. And when that patient comes in and says they want a band, we'll help them get their band. We'll put in a band as carefully and as correctly as we can, and we'll help them manage the band the best they can. Why does the band seem to be falling in popularity? I think the main reasons is because of the long-term complications with the bands. The frequency of slips and erosions can be alarming and have discouraged a lot of bariatric surgeons from putting in bands. But probably the thing that discourages most bariatric surgeons from putting in bands is the weight loss failures. The band needs to be put in correctly, it needs to be adjusted correctly, it needs to be maintained, and the patients need to practice good eating habits after the band is placed. The band seems to take away seconds, and it seems to take away the feasts, and it has some effect on reducing your appetite, but it sure is easy to defeat the band. You can graze on high-calorie liquids and soft, easily digested, highly refined carbs and fail in your weight loss effort. And when it comes to adjusting the band, I heard one very experienced bariatric surgeon, a fellow who's put in thousands of bands, one of the original band pioneers. And he said that in his experience, in about a third of the patients, it's easy to find that sweet spot where the band is adjusted to the correct pressure-volume combination that it helps the patient. It controls their appetite, makes their meals small. And in about a third of the band patients, it's really hard to find that sweet spot. The band is too loose, and then finally it's too tight. They can't eat healthy foods, and then we take out some fluid, and then it's too loose, and then we put in a little bit more, and it gets too tight, and then finally we get it, and the patients are successful and happy. And in about a third of the patients, it seems that we never are able to find that sweet spot. They never seem to want to tell me that this is great, this is working for me, I'm happy with this. And in some of those patients, they just go away because they're discouraged, and in some of the patients, they ask us to convert that to another bariatric operation, either a gastric bypass or a sleeve gastrectomy. And the strategy of I'll have a band because it's the safest operation, and if it works, great, and if it doesn't work, I'll have them convert it to another operation, is not a good strategy, because the conversion of a band to a gastric bypass or a sleeve gastrectomy is technically a very challenging operation and can be a very dangerous operation. And it's something we do, but it's always a thrill. And so the reason the band is going down in its frequency of being placed is because of long-term complications that are discouraging mainly the bariatric surgeons who have to take care of these, and the significant frequency of patients who do not ever achieve the effective weight loss they want. Now, I've had patients who have lost 80–90% of their excess body weight with the band and are just thrilled to death, and they're doing fabulous. And that's what keeps me putting in bands. And for that patient who says that I want the band and it's the only bariatric operation that I'm willing to undergo, we'll help them have a band. But I think that when we present our informational seminar and frankly discuss these things about the band, that the vast majority of the patients choose a different bariatric operation after they have that informational seminar that we give. That our goal is to allow the patient to make an informed consent about which operation is right for them.